My name is Veronika Cepková and I come from Czech Republic. I founded Whisper's Magical Children's Hospital and Maternity here in Jinja just 6 years ago. Whisper is a charity organization that was registered in England back in 2010. In 2012, I moved full-time here to Jinja in Uganda, and at the time Whisper only had few casual employees, but today we employed 106 full-time employees, mainly professionals in medical and administrative field. Whisper's mission is to revive trust in charity and humanity by becoming the children's hospital with the highest positive impact in Africa. To ensure that Whisper has the highest positive impact, we work closely with the licensing bodies such as NGO Bureau, Ministry of Health, or Uganda Blood Transfusion Services, and other organizations that directly impact lives of our patients and employees, and also the run of our organization here in Uganda. To ensure that our donors feel the constant need of helping our charity organization and donate to us, we always look for ways how we can get the most out of $1. Our hospital and our charity is always looking at opportunities how to improve on our activities, how to be part of the solutions but not part of the problem in the society. To ensure that our medical efforts have even greater impact, our hospital provides free pampers to our patients, free meals to our patients and their caretakers, as well as free blood tests and continuous medication throughout their admission. Some of the Whisper's values is transparency, honesty, and always going the extra mile for our patients and for one another. Doing the right thing is something that we advocate for every day. Uganda is a challenging country. Doing the right thing sometimes is something that may not be that easy for every one of us, but we continuously work with our workers. We encourage people around in our community to always remember that doing the right thing is something that is going to move us forward, and at the end of the day, it's going to have the long-lasting impact on our beautiful Uganda.
All hospitals you find around are always inclined to adult medicine. Even the equipments you find, the medical equipment, majority of them that are produced for adult medicine. And usually that is the case because people believe, I'm talking of now people who are into profit making, so they believe that there is money in that sector. That's for the adult medicine. But when it comes to children, it becomes an area which is neglected. So people don't really look into it. So, and it's even worse in cases whereby a parent, that's for parents who cannot even afford the proper healthcare for the children. So you find that this group of the society, that's the children, they're usually marginalized in terms of healthcare.
Many people get surprised when we are a charity hospital, but when we are hiring some of the most expensive doctors and expatriates. What we need to understand in the health sector, it's a challenge. Why? Because most of the specialties are not easy to gain in Uganda. It's only that government that owns most of the specialists. You can't find them in Uganda. So to find a hospital where you can get any kind of service that you could find in Uganda is one of the most unique things. And this is what Whisper stands for. You get some of the most vulnerable people who can't afford anything, but they get access to some of the best services they can never find in this country.
Our administration also ensures that our nurses and doctors have the latest knowledge from their medical field. We do daily drills to ensure that our intensive care department is always up to date and our nurses are well trained. We invest into personal development and further education of our employees.
I have passion for children. I am myself a mom of 4, aged between 5 and 12. So to me, I feel the best gift you can give a child is a happy childhood. And when I was choosing a charity to give back, I connected to charity like Whisper's Charity because it's a children's hospital, and growing up in Africa, I know how big challenge they have with facilities and love and care. So to me, it was really important to give back to something I can connect to. And because I'm a mom, when my children are not well, I really don't function. I want to see my children happy, healthy, because they are the future.
Our biggest challenges are, of course, finances. Finances are always never enough. Because of finances, I keep having sleepless nights for the last decade. It is always a challenge to ensure that every month you'll get to be able to get enough funds to fund all of our activities, people's salaries, tracks, and that we can provide the best care to our patients. The last 2 years of COVID lockdown had been really, really challenging for our charity organizations. But I'm very happy that with people like Emmeline and other donors, we have managed to pull through, and we had really, really saved many lives that otherwise wouldn't have been saved. Throughout the hardest lockdown, thanks to Emmeline, we treated over 1,000 patients in only 3 weeks. We've organized free medical camp inside our hospital, free surgeries. Thank you, Emmeline, and thank you to all of our donors and to our amazing employees that we had been successful throughout the COVID lockdown. Some other challenges that Whispers Hospital has is the lack of specialists in our hospital. Currently, Whispers educates 2 doctors into pediatrics, and hopefully we will be able to continue doing more. What hurts me the most is that people don't believe in our medical care here in Uganda. One of the things that I'm trying to change is to install the confidence in our medical workers, so we can all create that kind of environment where we feel comfortable to live in and die in. It is in our power to make sure that we establish that kind of medical services and that kind of professionals that we can trust, and we will believe that they are the best. So we won't need to feel the need to travel outside of Uganda for better medical services. That's what Whisper is currently working on, and that's the bigger vision that we have for this country. And I hope that people like Emmeline and other donors, other supporters, our suppliers can really come on board with us and to make sure that we can actually make this happen.
So when we call on the community, we want them to understand the kind of service we offer in the country. Not only the service, but the exemplary kind of service we are offering in this Uganda. I believe if all the medical people in the Ugandan government had worked with a charity hospital, they would understand what we need. So I call upon everyone in this country and outside the country to get to understand our service, to understand what kind of people we are dealing with, the kind of people we are serving, so that they can be able to help each other.
Our vision is to change healthcare through love and happiness in Uganda and around the world. We understand that changing healthcare through love and happiness by just providing medical services to patients may not be enough. We would love to have a bigger and greater impact than that. So we have decided to open up a nursing school so we can educate our own nurses that will be able to impact other people's lives, perhaps in other countries or different medical centers in Uganda.
If someone actually has the heart for, or the passion for medicine, I think because if you're mainly looking at targeting, those elites or those people who you think are the privileged, you may not actually get satisfaction in it, because I think the satisfaction you should get from medicine will be when you're able to touch that little child who had no hope. You've treated that patient as a doctor, and you see that child jumping out of the bed. The mother may never have the money to pay you enough. Even at times, they may not even tell you thank you. But you seeing that happiness and that you've brought life back, or you've been able to save a life, I think to me that should be motivation enough for anyone who is a doctor or a healthcare practitioner.
I have worked in many organizations, handling many employees, but being part of such a call as a Ugandan, I feel happy, because this hospital was started by a Czech Republican who is employing Ugandans for Ugandans. I feel proud that there's someone out there who can come to our country and give us service of this kind. So being part as a Ugandan of such a call makes me really proud. And I would love, by the time I leave this hospital, I have made a change to the Ugandans, my own people.
We are 4 medical students from Czech Republic in Europe, and right now we are volunteering here for 1 month. At the beginning, we just didn't know what to expect from healthcare here, but now we see the big difference between Europe. For example, in Europe, you have health insurance and almost everything is for free for you. But here, the healthcare is very expensive and not every family can afford it. Also, the big difference is that, for example, here they misscan a lot of medication or CT scans. But still, I would say that this experience was a very, very good one for us, because we have been able to see diseases like malaria, sickle cell, tuberculosis that we almost don't have in Europe. So I would recommend to every medical student to come here and join the team as we did.
I would love to thank the Ministry of Health to partner with us so we can run a free sickle cell clinic every week. Currently, we provide drugs and tests to around 250 children born in sickle cell disease. I am very happy for this opportunity. This is something that I would love to work towards in the future, to partner with the people that can make a difference with us.
My monthly contribution to Whispers Children's Hospital helps the hospital to run and to empower vulnerable families to access low-cost medical services in the Jinja community. Even the smallest contribution helps save lives and gives children a chance to a healthy life and to pursue anything they set their mind to. It means that I take part to make the changes I want to see, and I encourage you to do the same, because together we stand stronger.